many people think radiology is the coolest specialty in medicine. So from your experience, it's a very long experience, is that true?
What makes it cool is we are at the crossroads of this, between the patient care and the technology.
I would like to ask this question on behalf of all the specialists who are exploring UAE opportunities. So, doctors, for radiologists in India who want to work in the UAE, what's the actual pathway like?
When it comes to UAE, we have three different health authorities. You should be completing 3 years post MD or DNB, then you will be eligible to give this examination.
Are there jobs currently in UAE for Indian trained doctors?
When it comes to the job opportunities, it keeps expanding and it becomes static at one point of time. But I feel with the given developments, what we are seeing, it's visual for us now.
Hello everyone, welcome to Go Campus. So today we are very happy to welcome Dr. Venkatesh, a highly skilled radiologist with expertise in MSK and neuroradiology. Beyond his clinical work in India and the UAE, he is also the creator of Shades of Radiology, a YouTube channel dedicated to teaching and mentoring young doctors. He is an author, mentor, AI enthusiast, passionate about shaping the future of medical imaging. Thanks a lot for joining us today, Doctor. Thank you for your time. Can you just give us a small brief about yourself before we start the podcast today?
Very good morning, Ms. Ashwini. Thanks for your brief introduction about me. That's great to collaborate first with Go Campus, and I would really suggest that it's a great team that you have been from the beginning, which I've been observing that the great teamwork, which I would like to say, and myself being a radiologist working in UAE past 3.5 years. Previously, I've been working in India. I have worked in medical colleges and I have been in the teaching profession because teaching is my passion itself. And I have been delivering various guest lectures and I've been mentoring a lot of people. They keep giving me the messages. I need some guidance regarding the fellowship, some examinations, and how to pursue my career in future. What about the AI in radiology and all these things? So it keeps me motivating not only uh, about my subject, but as well the people approaching me, my colleagues, my seniors, my juniors, and like a lot of new budding radiologists who are coming up. They keep approaching me, and that makes me more motivated to pursue this field. As of now, everything is like it's like a still a spark. Still, I feel radiology is always new for me. That's what I would like to say regarding my practice or my clinical experience till now.
So, Doctor, totally how many years of work experience do you carry in radiology?
So I have been finished my MD in the year 2015. After that, till this is 2025. So of course, post MD, I'm having more than 10 years of experience.
Great.
Yeah.
So, with all the years of experience that you have, and I want to ask this question to you because many people think radiology is the coolest specialty in medicine. So, from your experience, it's a very long experience, is that true? And what really makes radiology stand out?
I do believe the radiology stands out as one of the dynamic specialty. It's not like a static. It keeps progressing. And also what makes it cool is we are at the crossroads of this, between the patient care and the technology. If you say we work with the machines, so we are at the crossroads, like we are in between, like we are giving the future guidance for the clinician to guide the treatment pathway. That's how the radiology is now, I feel, and it keeps innovating, keeps growing.
Thank you, Doctor. And, Doctor, what first drew you into radiology and why did you choose this specialty? Was there any particular reason that made you go for it?
Yes, I would like to say when I was working in the internship, that is the first time we encounter more of radiology. When it comes to that, I used to see like big machines that we have been using like CT, MRI, and ultrasound machine. It was completely vague for us. We don't know what exactly is happening there. It's everything black and white. So I was like so much enthusiastic to learn what exactly is happening, how they are seeing it. In general, I want to see everything. I was in need of what all the specialties. I want to know whether it comes to neuroimaging or orthopedic or the pediatric or the ob-gynae. So I was into everything. Like I was loving each and every subject. And given the reservation system, I thought I would not get into radiology, but my hard work has given me really the specialty which I have having a lot of interest.
So, Doctor, I have gone through your profile and I see that you've earned European diploma in radiology. How does it impact global career opportunities today? And if you can just if you can just share some insights on it, because we do have, I guess, many radiologists are watching this podcast. I would like to know how this course can benefit the radiologists who are currently exploring global and international opportunities.
Yeah, coming to the degree part, like European Diploma in Radiology and FRCR, these are now like a good credentials for your CV, I would like to say. This is actually not a course. This is the examination certificate which is accredited by the European Diploma, the European Board of Radiology. And when it comes to FRCR, the UK, it comes to the UK board, which it is a recognized certificate that you are having an international standard of knowledge and to practice as well. So with this EDIR and FRCR, there is always a global career opportunity for you. With the given competitive job market, if you are having this EDIR or FRCR or both together, it gives you an additional benefit for the placement of the jobs and also in the research opportunities as well. So I would like to say, like whoever is coming out, the EDIR and FRCR, it's not a mandatory examination to be given. It depends upon the future perspective. Like if they want to explore more opportunities, then I would like to say go for it. EDIR and FRCR are going to add a lot of value for your CV, and it opens a lot of global opportunities for yourself. Whether it goes when it comes to USMLE or the UK, or you want to go to Australia, if you are having an additional degree, there is always weightage. You might be hearing about the weightage, so it always plays a major role once you have cleared these examinations of international standards.
So this EDA, is it a one part, two part exam, and anyone who's done MB radiology can take this exam, doctor?
Yeah, there is a eligibility criteria for everything, like either EDR or FRCR. There is an eligibility criteria. We need to go to their websites, check for the eligibility, and EDR is a single examination for the radiology purpose. When it comes to radiology aspect, it is a single examination. It has parts in itself, but the examination is held in a single day. So it's not like 2 days or 3 days or Viva and all those things. As of now, it is a single day examination which has three parts, three segments in it, and everything has the examination part has been mentioned in their website.
Okay, done. And doctor, we understand that radiology is evolving fast. Like we do meet a lot of doctors from India itself for exploring once they're done with MD radiology. We hear doctors talking about AI, interventional radiology, teleradiology. So from a career perspective, which of these areas do you think has the better scope for the next couple of years, let's say?
Yeah, this I would like to say everything is like now interlinked. We can't say AI segment is going to develop alone, or we can't say only interventional radiology is going to develop. It's linked to each other. As AI tools have been being integrated with all the modalities, like all, if you take from X-ray, ultrasound, CT, and MR, and even intervention, the AI tools or AI softwares have been implemented to guide the radiologist to give an accurate diagnosis as well as treatment. When it comes to diagnostic radiology, it helps us for decision making, which is increasing the accuracy. Second thing, when it comes to intervention radiology, the AI tools are helping us to guide the perfect treatment. Whether you take a vascular intervention or a biopsy, these AI tools are helping us a lot. So I would like to say, like AI alone or the teleradiology alone or the just a general radiology alone is not going to be unique career in future. It has to be integrated, and we need to evolve and use these tools to make yourself upgraded.
Thank you, doctor. Now, I think I'm sure many aspiring radiologists will also be watching this podcast because this is NEET PG time. We see many doctors, parents coming to us, and asking about, because we do have mentorship platform and doctors can connect to specialists and know from them what it is like living in this branch. So we do have many parents, doctors sometimes who ask us because they get to see so many things online about radiology. We know in India radio dermat and medicine is high in demand compared to other specialities like other countries where surgery, ortho, they all are high in demand. Many, I mean, doctors want to do radio, but many parents will say, do you want to really invest so much in radiology? Because all radio seats are, the paid seats are quite high. It's all management NRI seats are 80 lakhs, 90 lakhs, 1 crore, 1 crore, 20 lakhs per annum. So when parents ask us, like, they say that we're hearing a lot, we're seeing a lot, will radiology stay as it is, or gradually there'll be no jobs for doctors who are going to explore radiology? Do you want to, give some insight on it? I mean, having more of AI, using more of AI, is it like, it's going to create job challenges for radiologists? Or, as you said, is it going to open new career opportunities for doctors in radiology who are going to upgrade with AI tech tools? Can you just can you just give some insights on it, doctor?
Yeah, well, that's a great question, and that is the main query to a lot of postgraduate the graduates who have been passing out. They have these doubts of AI is going to replace this medical field. What are we going to do? But I love radiology, and I don't know what to do. There are a lot of people are in this confusion actually.
And
So
because parents are investing money, they will think double time. Is it really worth investing so much money? Though doctor wants to do radiology, rather they feel that okay, evergreen branches are medicine, pediatrics, kind of go for this branch. So we always see this discussion happening between parents and students.
true, that's true. See, when it comes to AI in radiology, like everyone is thinking that it is going to replace the radiologist, it's never going to replace. That is the first thing. Coming to second thing, the radiologist who is going to utilize these tools to their extent and evolve with these tools is going to be the leading person in the radiology field. If you're not utilizing it, you will be backward. And there will be always someone who is upgrading himself, being in par with the AI development, utilize the AI tool and implement it in your clinical practice. It will increase your accuracy. The clinicians will trust your radiology report because you are utilizing the AI tools. You will be more accurate when compared to the radiologist who is not using an AI tool. So it is increasing because with the screening also there is a lot of studies showing the AI with the radiologist, AI without radiologist, and AI alone and radiologist alone. If you see this, AI with radiologist combined will be having the highest accuracy. So whatever the final thing, what I would like to say is it will not reduce the job opportunities. It might in fact create more opportunities in AI field as well. Means we will be not be going into AI per se. We will be going into how to implement this tool, whether what are the ethical issues, how should we consider in the management, and how should we incorporate in the regular workflow and in the screening programs. So once you know and you are keeping updated yourself with these AI tools, the developing AI tools, I think you will be more on demand if you're utilizing these AI tools. I would like to say AI is going to be more helpful and it is going to give more accuracy and you will be upgraded as like a next gen radiologist with the AI tools.
Thank you for that, doctor. I'm sure it is eye opening for all the doctors exploring radiology. Now, we all know that Dr. Venkatesh is currently working in UAE. And I'm sure many specialists are watching this video. So I would like to ask this question on behalf of all the specialists who are exploring UAE opportunities. So, doctors, for radiologists in India who want to work in the UAE, what's the actual pathway like? Which exams or let's say which licensing exams are needed for them? And what's the process like?
When it comes to radiology, and if you are really willing to practice in UAE, I'm talking only about the UAE, I'm not talking about the other Middle East countries. When it
Okay.
comes to UAE, we have three different health authorities in UAE, that is the MOH, DHA, and Abu Dhabi, that is DOH. So these are the three qualifying examinations which needs to be cleared once you finish post MD or DNB 3 years. You should be completing 3 years post MD or DNB, then you will be eligible to give this examination. So once your eligibility is clear, then you can apply for two things. These are the two main things which before you enter into UAE, like the pathway to UAE is the data flow and the examination. Data flow is nothing but they will be verifying your experience, your degree certificates, and everything online through the online system. Second, the examination, like you will be giving the examination to that particular emirate. Like if you want to work in Sharjah, MOH, if you want to work in Dubai, it is DHA, and if you want to work in Abu Dhabi, it is DOH. And again, nowadays, the Emirates, the UAE government has made it interchangeable. Once you give a particular exam, it is interchangeable and you can change the eligibility to other emirate as well. Suppose you are giving a DHA exam, you have cleared the DHA exam, and you will be eligible to work in Sharjah as well because the DHA eligibility will be converted to MOH eligibility. So depending upon these all these requirements and the guidelines are given in their websites, which they are
Hmm.
upgrading every day, like year to year. There might be some changes, but you need to be aware before applying. Kindly to check the website before you proceed.
Okay, done. Thank you, doctor. And doctor, how difficult or easy is this licensing exam, whether it's MOH or DHA? Is it very difficult or it's very doable for radiologists?
I would like to say it's not difficult and it's not easy because there is always a theoretical part as well, not only the practical part, which the examinations always consider everything, like the practical as well as the theoretical aspect. Most of the radiologists, once we finish, the MD or DNB, we will not be in much with the theoretical part. So when it comes to theoretical part, you need to prepare for the examination, and the practical aspect also you need to be upgraded year by year because the guidelines will be getting updated. So that is the second thing. So I would like to say when you are giving ADIR examination and FRCR examination, this DHA or MOH or HOD DOH exam is going to be a cakewalk, I would like to say. And it's not easy as well. So I would like to suggest these materials, whatever you are preparing for ADR and FRCR, will be more than enough to clear the DHA exam.
Thank you, doctor. And doctor, how different is because you've worked in India and UAE? So how different is clinical practice in UAE compared to India, both in terms of opportunities and challenges?
Yeah, well, this is like now a difficult question to answer because in UAE the radiology practice is more of protocol driven. Like we follow the protocols according to the guidelines, and the patient safety is of more important. And also the advanced technologies have been being implemented faster when compared to India. If you take in India, it's a huge country because there are few cities which have very advanced technology, and there are the places like towns and villages where they don't even have a CT or MRI machine as well. But I would like to say the advancements in the technology is more in UAE.
Now, let's say for Indian trained radiologists, how are the job opportunities currently in Gulf? Because we do receive many calls from doctors who are exploring global opportunities. Currently, we know in most of the countries there is this anti-immigration protest. So many things that we get to see online, read online, see videos. Most of the doctors ask, okay, even if I do this exam, what's the future like? How early will I get a job? Are there jobs currently in UAE for Indian trained doctors? Do you want to say something on it?
Yes, coming to that, I would like to say it's being saturated because the reason being a lot of people want to work in UAE with a better lifestyle. That is the main reason the people are willing to work in UAE. I feel the UAE is one of the safest places where the government is like very supportive. And when it comes to the job opportunities, it keeps expanding and it becomes static at one point of time. But I feel with the given developments, what we are seeing, it's visual for us now. We are clearly visible. It's clearly visible to us that the Dubai and UAE is growing faster. Once the expansion is happening, automatically the healthcare facilities also keep expanding. So gradually the opportunities will come up, and it's going to be more in coming future. But at the same time, it depends upon the people who are migrating. It's not only India. Nowadays, we are seeing the people coming from UK, USA, and Australia as well. So it depends. It's highly variable kind of thing, but still there is a lot of growth and a lot of opportunities will be coming up in the future in UAE. Yeah, yeah, exactly.
So, last question for the podcast today. If you had to name three must have skills for the young radiologists today, what would they be?
Well, when it comes to these three, the question which you have asked is the three skills for the young
Three must have
radiologist.
skills for young
Okay.
radiologists today.
Yeah, okay. The first thing I would like to say, the fundamentals, the basic thing in radiology, like anatomy and pathology, you need to be very strong in the fundamentals
Mhm.
because AI is going to just assist you. It's not going to give you where it is and what it is and all. So you
Mm.
need to be very strong in the basic fundamentals of anatomy and pathology. First thing which I would like to suggest for the young radiologists who are coming out. Coming
Okay.
to the second one, I would like to say the adaptability to the technology and the advances happening in radiology because we work with the technology. If
Mm.
you take an ultrasound machine, we work with the technology. So you need to be adaptable to that growing technology. You need to be able to learn. You need to be in touch with the advancements, whether it will be useful or not, how I can put that adaptable kind of new technology in my clinical practice. So that is the second point. And coming to the third point is I would like to say the communication skills. When it comes to the communication skills, it's a good radiologist or a very accurate radiologist can give his findings in the report. But where it comes to finally is how you convey it to the patients and the clinician.
Mm.
So that changes everything. So your communication skill should be like as soon as you perform, take your time. Once you give the report, then try to communicate with the doctor or the clinician who has referred that patient to you in a easiest way so that it will be easy for them to explain to guide the treatment pathway for the patient. So the communication skills is one of the last but not the least I would like to say is of very important nowadays, which plays a major role in your career as well. And also, this will help in the social circle. As you know, the growth of the social circle is very important nowadays, which helps you not only the build your skills as well as to grow your opportunities. The more you keep communicating with a lot of people, as being an expat in UAE, you will be encountering a lot of people from different countries. The more you communicate, the more are the opportunities. So I would like to say these three things are must to have for a young skilled radiologist.
So thank you so much, doctor. I guess that's the three most important skills that a young radiologist must have or should develop now if you don't have it. Let's say if you're already a radiologist, if you're exploring UAE opportunities, you know whom to talk to now. You can book a one-on-one session with Dr. Venkatesh. You can go to www.gocampusworld.com. Sessions are open now, so you can certainly book a session and talk to doctor and understand about your work opportunities, job opportunities in UAE. Let's say if you're an aspiring radiologist and you're really worried and stressed about all the things you're reading online, you really want suggestion, advice, guidance from someone who's living this branch day to day, then you know where to go now. So please do book one-on-one session with Dr. Venkatesh if you wish to know if radiology is for you and what it takes to be successful in this branch. So thank you so much, doctor. Thank you for your time.
Really, I would like to thank Ms. Ashwini. It's a great opportunity for me as being a mentor. Like I was behind the screen, I've been guiding a lot of people, but I feel now Institute is giving me the opportunity to openly discuss with one-to-one sessions with a proper way of clearing doubts, all the queries in their minds which are coming up with the advancing AI, and especially when it comes to radiology. So I would like to thank you as well as your entire team for this.
Thank you, doctor. Thank you. And all the very best to each one of you watching this podcast today. Thank you.